Hello, my name is Dominique Cross. I'm a student at Indiana State University. Today I'm going to be talking about hypertension and the effects it has on the heart. More specifically, it's going to be coronary artery disease. This is Community Health Nursing Health Education Project number 2. After completion of this video, the students will be able to identify the risk factors for CAD, explain the pathophysiology of CAD, recognize the signs and symptoms of CAD, discuss the multiple causes that hypertension has on the heart, and list the treatment methods used to increase the blood flow to the heart. At this time, you can pause the video and take the pretest. Click on the link below in the comment section of this video. So a little background here about hypertension and the effects it has on the heart. Hypertension can cause many heart problems such as coronary artery disease, which is arteries narrowed and damaged by high blood pressure, having trouble supplying blood to the heart. Too little blood flow to the heart can lead to chest pain, which is also known as angina, or the heart may also have irregular heart rhythms, which is known as arrhythmias, or you can have a heart attack. Also, an enlarged left heart, which is high blood pressure, which is when high blood pressure forces the heart to work harder to pump blood to the rest of the body. This causes the lower left heart chamber, which is the left ventricle, to thicken. A thickened left ventricle increases the risk of heart attack, heart failure, and sudden cardiac death. Also, heart failure can occur. Over time, the strain on the heart caused by high blood pressure can cause the heart muscle to weaken and work less efficiently. Eventually, the overwhelmed heart begins to fail. The pathophysiology of coronary artery disease. So this is when the damaged or diseased arteries are those which supply blood directly to the heart muscle. A condition known as coronary artery disease is the result. Years, even decades, it may go undetected. However, decreased flow of oxygen-rich blood will eventually lead to troubles such as irregular heartbeat, which is known as arrhythmias, chest pain, and in the event of a total blockage, which will result in heart attacks. Coronary artery disease is the most common heart disease in the United States. Cholesterol deposits or plaques are almost always to blame. CAD is the most common form of heart disease, and it affects approximately 16.5 million Americans over the age of 20. It's also the leading cause of death for both men and women in the United States. It's estimated that every 40 seconds, someone in the United States has a heart attack. A heart attack can come from uncontrolled coronary artery disease. Diagnosing coronary artery disease requires a review of your medical history, a physical examination, and other medical testing, which will include electrocardiogram. This test monitors electrical signals that travel through your heart. It may help your doctor determine whether you've had a heart attack. Another test is the echocardiogram. This imaging test uses ultrasound waves to create a picture of your heart. The results of this test reveal whether certain things in your heart are functioning properly. Next is the stress test. This test measures the stress on your heart during physical activity and while at rest. The test monitors your heart's electrical activity while you walk on a treadmill or ride a stationary bike. Nuclear imaging may also be performed for a portion of this test. For those unable to perform physical exercise, certain medications can be used instead in place of the stress test. Cardiac catheterization, which is left heart catheterization. During this procedure, your doctor injects a special dye into your coronary arteries through a catheter inserted through an artery in your groin or forearm. The dye helps enhance the radiographic image of your coronary arteries to identify any blockages. And the last test is heart CT scan. Your doctor may use this imaging test to check for calcium deposits in your arteries. And symptoms of CAD. Potential symptoms may include chest pain, shortness of breath, and upper body discomfort in the jaw, shoulder, neck, or back. Damage left by high blood pressure restricts blood flow. The heart is forced to work harder than ever to provide the body with adequate circulation. All this hard work can cause thickening or stiffening of the heart. As the heart becomes weaker, heart failure can result. While the type of heart failure can vary, it is most seen as an enlarged left ventricle with signs of fluid buildup throughout the body. Symptoms for heart failure often include shortness of breath, fatigue, and swelling of the ankles, legs, feet, abdomen, or veins in the neck. Early and effective treatment of high blood pressure is very crucial. Symptoms can also be mistaken for heartburn or indigestion. Risk factors for CAD will include high blood pressure, tobacco smoking, high blood cholesterol levels, insulin resistance or hyperglycemia or diabetes mellitus, obesity, inactivity, unhealthy eating habits, obstructive sleep apnea, emotional stress, excessive alcohol consumption, history of preeclampsia during pregnancy. The risk for CAD also increases with age. Men have a greater risk for this disease beginning at age 45, and women have a greater risk beginning at age 55. The risk for coronary artery disease is also higher if you have a family history of this disease. CAD includes lifestyle changes that will reduce your risk of heart disease and stroke. For example, quit smoking tobacco, reduce or stop your consumption of alcohol, exercise regularly, losing weight to a healthy level, which is appropriate to your body, eating a healthy diet that is low in saturated fat, sodium, and added sugar. Early and effective treatment of high blood pressure is very crucial. If your condition doesn't improve with lifestyle changes and medication, your doctor may recommend a procedure to increase blood flow to your heart. These procedures may be a balloon angioplasty. With this procedure, it widens blocked arteries and smashes down the plaque buildup. This is usually performed with the insertion of a stent to help keep the lumen open after the procedure. Or the doctor may recommend a coronary artery bypass graft surgery. This restores blood flow to the heart in open chest surgery. Another recommended option by the doctor would be enhanced external counter pulsation. This stimulates the formation of new small blood vessels to naturally bypass clogged arteries in a non-invasive procedure. The outlook for coronary artery disease is treatable, but it is not curable. But before even developing CAD, preventive measures can decrease your chances. So take care of yourself, eat right, exercise. Now at this time, you can take the post-test and see how much you've learned. Thank you for watching my video. Have a good day. Have a good night. Bye.